my name is Kien Vu Trung.
And I'm Markus Hollenbach from the University of Leipzig Medical Center.
And we brought it about our new paper that titled Endoscopic papillectomy for ampullary lesions in patients with familial adenomatous polyposis compared to sporadic lesions in propensity score matched cohort. FAP is an autosomal dominant inherited disease showing a mutation, preferably in the APC gene, that predispose the development of adenocarcinoma in the gastrointestinal tract. In FAP patients that underwent proctocolectomy, the main region at risk for precancerous lesions is the ampulla of Vater. An evaluation of the ampulla is recommended in the surveillance of FAP patients, and the standard therapy of ampullary lesions includes the endoscopic papillectomy. However, data on endoscopic papillectomy of FAP patients are limited, and in our study, we compared the efficacy and safety of endoscopic papillectomy for patients with sporadic ampullary lesion and patients with FAP that were matched by propensity scoring.
In our study, we used a multicentric retrospective database of the ESAP study that includes more than 1,400 endoscopic papillectomies. All adult patients who underwent an endoscopic resection because of an ampullary lesions were considered, but patients with periampullary lesions and advanced ampullary cancers stage T2 or higher, or with nodal or distant metastasis were excluded. We performed a propensity score matching for patients with FAP-related and spontaneous ampullary lesions based on age, gender, comorbidities, histology, and size of the lesion to obtain comparable groups. By this propensity score matching, we could identify 101 patients that were FAP-related and 101 sporadic lesions, and the histological findings of the resected specimens showed mostly adenoma with low and high-grade dysplasia, and the median size was 15 mm in both groups. The ampullary lesions were mainly asymptomatic in the FAP group, and this was a consequence of the regular screening of these high-risk patients. The sporadic ampullary lesions were more often symptomatic, and after the initial intervention, the rate of the complete resection, the RCU rate, was significantly higher in the spontaneous group, but after a repeated intervention, the technical success was 93.1% in the FAP group and 97.0% in the spontaneous group. The overall complications were reported in about 29% of cases in both groups, and pancreatitis and bleeding were the most common adverse events. The recurrence rate was between 50 and 20% in both groups without significant differences. The FAP patients relapsed after a median of 25 months, and the patients with the spontaneous lesions recurred after a median of only 2 months.
In conclusion, FAP patients have a high risk of developing new FAP-related lesions in the whole gastrointestinal tract, including the ampulla of Vater. And the EP is safe and effective in FAP-related ampullary lesions, and the criteria for endoscopic resection of ampullary lesions can be extended for FAP patients, and FAP patients have a lifetime risk to relapse even after complete resection and require a long-time surveillance.